Do you still pee like a 25-year-old man? Because if you wake up 2, 3, or even 5 times a night to use the bathroom, we need to talk. Not just because it's annoying, but because it could be the one thing quietly wrecking your energy, your confidence, your testosterone, and your sex life. Let me tell you about Paul. He's 58, healthy, active, a former Marine. But for the last 6 months, he told me this. Doc, I feel like my bladder owns my life. I can't sleep through the night. I don't want to travel. And intimacy, I avoid it because I'm too damn uncomfortable. He thought it was just part of getting older. He tried over-the-counter pills, herbal stuff, even cut down on water. Nothing worked. Until he found out what was really going on. Paul had BPH, an enlarged prostate. It's not cancer, but it shrinks your flow, ruins your sleep, and slowly chips away at your masculinity. And here's the thing. By the time you hit 60, more than half of men already have it. Most don't even know. Now here's the real shocker. The wrong treatment can leave you dry in bed. Literally. Some options affect ejaculation. Others mess with recovery time. And worst of all, many men don't get the whole truth before going under the knife. That's why today's video will break it all down, from the latest surgical options to which ones protect your performance and which don't. I'm Dr. Hannah, and my goal is simple. It is to help you regain control of your body without losing what makes you feel like a man. The silent squeeze, what an enlarged prostate really does to your body. Most men don't notice it right away. It doesn't hit with pain or panic. Instead, it starts subtly. Just a bit of time in the bathroom, a slower stream, a need to push harder. But over time, that silent squeeze from an enlarged prostate begins to take a real toll. I had a patient, Greg, 61, who said it best. Doc, I used to be in and out in 30 seconds. Now I feel like I have to negotiate with my bladder every time. What's really happening inside? As the prostate grows, it presses against the urethra, the narrow tube carrying urine from your bladder. Imagine stepping on a garden hose. The water's still there, the pressure builds, but the flow? It's weaker. This constant pressure can confuse your bladder. It starts contracting more often, even when it's not full. That's why you feel urgency, or wake up 5 times a night to pee. Over time, your bladder muscles get tired. They stretch. They weaken. And suddenly, it's not just your prostate that's the problem. It's your whole system. This chain reaction doesn't just affect your sleep. It drains your energy. It chips away at confidence. And yes, it can start to impact your sex life too. But here's the part that most men never hear. This doesn't mean you've done something wrong. It's not your fault. It's simply biology meeting time. And the earlier you understand what's happening, the more control you have over what happens next. So before you chalk it up to just aging, let's look at the warning signs your body is giving you. Signals that your prostate may already be causing more damage than you think. Fix it naturally? What works, and what's just internet hype? Every man I've ever treated has asked me this question at some point. Doc, is there anything natural I can do before going down the surgery road? And it's a fair question. The internet is full of advice, some good, some downright misleading. Let's separate the hope from the hype first. What doesn't work? I've heard it all. Pumpkin seed oil, stinging nettle, even drinking vinegar before bed. While these might not hurt you, there's little to no solid science behind them when it comes to actually shrinking the prostate or restoring normal flow. Then there's saw palmetto. It's probably the most famous natural remedy for BPH. And yes, some men report mild relief. but clinical studies are mixed at best. It might help a bit, but it won't reverse the condition. Now here's what does help, if done right and consistently. Losing abdominal fat can reduce internal inflammation and ease pressure around the bladder. Cutting back on caffeine and alcohol? That can minimize urgency and nighttime trips. Pelvic floor exercises? They're not just for women. They help men regain control and prevent dribbling. And perhaps most overlooked, managing your stress. High cortisol levels over time can mess with testosterone, worsen sleep, and trigger more frequent urination. I had a patient, John, 57, who started walking daily, lost 15 pounds, and did pelvic floor work. In just 4 weeks, he was sleeping better and peeing less often, without a single pill. Does that mean everyone can fix it naturally? Not always. But if you're serious about avoiding surgery or meds, your lifestyle has to lead the way. And if you're already doing those things but still struggling, then it may be time to consider what modern treatments are out there and which ones protect your performance. Let's get into that next. When pills aren't enough, how to know it's time for surgery. Let's be real. No guy looks forward to surgery. Most men I talk to will try everything else first. Pills, herbal teas, YouTube remedies at 2 a.m., you name it. And hey, sometimes those things help. For a little while. But if you're still waking up multiple times every night, if you constantly feel like your bladder's not empty, if you've started planning your day around bathroom access or skipping long car rides because you're worried, you owe it to yourself to ask a bigger question. Is it time for something more permanent? I remember Robert, a 64-year-old retired Navy guy. Strict, disciplined, didn't complain much. But when he came in, he looked worn out. Not just physically, but mentally tired of managing symptoms that wouldn't quit. He tried every medication in the book. Some helped a bit, but the side effects, low libido, dizziness, dry orgasm, started adding up. Worse, the results faded. Eventually, he came to me and said, "Doc, I just want my life back. I don't want to live around my prostate anymore." Here's the real turning point. When your prostate starts deciding how well you sleep, whether you can enjoy a road trip, how focused you are at work, or even how close you feel to your partner, it stops being just a medical issue. At that point, it's about your everyday life, your sense of self. And the truth is, prostate surgery today isn't what it was 20 years ago. We've got better options now. Faster recovery. Procedures that can be tailored to your body and your priorities. But you know the biggest mistake I see? Guys are waiting too long. They hold off until the bladder's already under strain, or until intimacy has slowly slipped away. And by then, it's not just harder, it's more frustrating to fix. Surgery isn't a punishment, it's a solution. And if chosen wisely, the reset button can bring back freedom. But with so many procedures, how do you know which fits you best, without risking your performance or comfort? That's precisely what we'll break down next. The Toolbox, comparing modern BPH surgical options. When men hear surgery, their first reaction is usually fear, and that's understandable. But what most guys don't realize is that we now have more tools than ever, each with its own strengths, risks, and benefits. The real challenge? Knowing which one fits you. Let's break it down. Imagine your prostate is a garden hose someone's stepping on. The goal of any procedure is to remove that pressure so you can flow again. UroLift is like using clips to pull the obstruction aside. No cutting, no heat, minimal risk to sexual function. It's quick, often done in the office, but best for small prostates. Rezūm uses steam to destroy extra tissue. It takes a few weeks to work, but it treats a broader range of prostate sizes and usually protects ejaculation. Then there's TURP, the gold standard. It clears the pathway completely, like repiping a blocked drain. But it often leads to retrograde ejaculation and needs more recovery time. I had two patients. Alan, 70, chose TURP and was thrilled with the flow but missed the intimacy. Chris, 59, went with Rezūm and kept his function and confidence. Neither is right nor wrong. The best tool depends on your priorities. Is fast recovery more important than long-term results? Is preserving ejaculation a must or a bonus? Are you dealing with a huge prostate? This is where a conversation, not just a prescription, matters most. Because with the right match, these procedures can restore your sleep, comfort, and confidence. But now that you know what's in the toolbox, let's talk about what's often left out of the conversation: how these surgeries really affect your sex life. Sex after surgery. What changes and what stays the same? This is the part that no one likes to talk about, but every man secretly wants to know. Will I still be able to have sex after surgery? And the honest answer is yes, but with a few changes you need to be prepared for. Let's start with what stays the same. Most men still feel desire. You can still get aroused. And yes, most can still have satisfying orgasms. However, depending on the procedure type, how your body responds changes. With surgeries like TURP or laser ablation, there's a high chance of something called retrograde ejaculation, where semen flows backward into the bladder during orgasm instead of exiting the usual way. It's not painful, and it doesn't mean you can't enjoy sex, but for some men, it feels emotionally different. I had a patient, Miguel, 62, who told me, "Doc, I still feel the pleasure, but when nothing comes out, it's like something's missing." For others, especially those who value intimacy over performance, it's not a big deal. The key is knowing ahead of time. Procedures like UroLift or Rezūm offer a better chance of preserving normal ejaculation. That's why your choice matters. The other factor? Recovery time. Some men expect to bounce back in a week, but your body needs rest. Healing from surgery is one thing. Reconnecting with your partner is another. So be patient with yourself. Communicate. And don't be afraid to ask for help from your doctor or even a therapist if needed. Because sex after surgery isn't gone. It just might take a new form. And often, with the right mindset, couples find their connection becomes deeper, not weaker. Now that we've addressed intimacy, let's turn to something just as vital: how to recover right so your results last. One man's journey, from catheters to confidence. Let me introduce you to Carl. He's 67, a retired firefighter, tough guy, no nonsense, the kind who rarely complains. But when he walked into my office, he looked defeated. "Doc," he said, "I've had this catheter in for 2 weeks. I feel like I'm falling apart." Carl had been dealing with BPH for years. He'd tried it all: medications, dietary changes, and even given pelvic floor therapy an honest shot. Nothing gave him lasting relief. Eventually, things got worse. His bladder simply stopped emptying. That's when he ended up in the ER and left with a catheter. That moment hit him hard. It wasn't just annoying anymore. It was controlling his day-to-day life. That's when we sat down, looked at every option carefully, and Carl decided on laser enucleation. Not the flashiest procedure, but perfect for his large prostate. Surgery went well, but the real journey started after. Week 1, frustration. He felt tired, slow, and unsure of himself. Week 2, a glimmer of progress. No catheter, better flow. Week 4, he walked into my office smiling. "Doc, I went fishing last weekend, for the first time in 2 years, and I didn't once think about where the nearest bathroom was." That's what Carl told me at his follow-up. And honestly, it wasn't just his urine stream that improved. It was everything. His confidence came back, his freedom, even how he carried himself. What made the difference? Carl took recovery seriously. Carl didn't take shortcuts. He got up and moved, even on the tough days. He scaled back on the coffee and skipped the nightly drink. He stuck with his pelvic floor exercises, even though it felt a little weird at first. But the most important thing? He never lost faith in the process. He believed healing was possible, and that belief shaped everything. So if you're in the thick of it right now, feeling stuck, unsure, maybe even depending on a catheter, don't lose hope. Carl's story is proof. Recovery is real. Freedom is real. And confidence? Choosing your path. Questions to ask before saying yes to surgery. By now, you've seen the options. You've heard the stories. And maybe you're seriously considering surgery. But before you say yes to anything, I want you to slow down and ask yourself 5 questions that could save you from regret later. First, how big is my prostate? Not all procedures work for all sizes. Something like UroLift may not work well if your gland is over 80 grams. That matters. Second, do I have a median lobe? It's a small detail, but it changes the game. Only a proper scan or cystoscopy can reveal this, and it can determine which surgeries are safe or risky for you. Third, how important is ejaculation to me? Be honest with yourself. If preserving that function matters, some surgeries should be off your list immediately. Fourth, what's my health status? If you have heart issues, diabetes, or take blood thinners, specific procedures may carry more risk or need more prep. And fifth, am I ready to commit to recovery? Surgery isn't magic. It's a reset button. You'll need to show up for your own healing through movement, diet, bladder training, and mindset. I had a patient, Barry, 66, who wrote these questions down, brought them to his urologist, and made the best choice for his body, not just the one with the flashiest name. You can do the same. Because when you choose with clarity, not fear, you take back control. You don't just treat your prostate. You reclaim your life. So if you're ready, I've compiled a simple, printable checklist that covers all 5 questions and what each answer might mean for your care. You can find it linked in the description below. But first, let's recap everything we've covered today and help you take your next step with total confidence. So let's bring it all together. If you're a man over 50, waking up every night to pee, feeling like your bladder runs your life, this isn't just part of aging, it's a signal. We talked about what an enlarged prostate really does to your body. We looked at natural options, what works, and what's mostly new normal. You don't have to live stuck. You deserve better. You deserve to feel like you again.